Hey everyone, this is Derrick Broze with the Conscious Resistance Network. In today's report, we're going to be looking at the debate surrounding transgender individuals and gender identity issues. We're also going to specifically look at how these debates are influencing young adults and children. And we're going to see who is benefiting from the amplifying of these debates, which are often very divisive. Now, you may have noticed in the last year or two in the United States, there are several states passing laws dealing with transgender and gender identity issues. Some states are going the route of attempting to ban access to knowledge by banning certain books or what can be taught in courses in public schools and even in colleges, while other states are going the route of focusing on raising the age for transgender surgery to the age of 18. A 2022 Pew Research poll found that the United States is pretty evenly divided across partisan lines when it comes to views about whether or not acceptance of transgender individuals is a positive or a negative thing for society. You had those who are aligned with the Democratic Party, 59% of those individuals saying that they thought it was a good thing, and then you had 54% of people who align more with the Republican Party saying that they felt that acceptance of transgender individuals is actually a bad thing for society. Unfortunately, discussions around these sensitive topics tend to be argued in the extremes. You have one side that says if you ask any questions about gender surgery or hormones, that you must be a bigot or a transphobe. And then you have the other side, the other extreme, which does include people who genuinely do not like the LGBTQ community and might want to pass laws to limit their rights or do things like abolish pride parades. Now, I say that this is an unfortunate reality because for me, I think what's happening here is that the individuals, the human beings at the core of this discussion are being forgotten. I want to encourage anybody who's going to watch my report to watch not only with an open mind, but most of all with an open heart. We have to remember that there are individuals, human beings, both children and adults, who are at the core of this discussion. And I think that we can all agree that when it really comes down to the focus around gender identity and everything else that springs from that, that whatever we decide and wherever we go from here, the implications are going to be huge for our society moving forward. I'm also doing this report for any individual and any family members of individuals who may be dealing with this situation and are actually just uncertain of where to find factual information regarding this discussion. The information I'm about to share from you will all be listed in the show notes for this report. This is an open source investigation based on publicly available data, my own sources, and an interview with a trans person.
My name's Calvin Rose. You can just call me Calvin or Cal, whichever's easier for you.
And Cal, how do you identify yourself?
I'm non-binary, trans-masculine. I'm AFAB, which means assigned female at birth, but I align more in a gender-neutral, leaning masculine position.
Tell us about your journey to coming to identifying this way.
Well, I've known something was not quite right since I was about 15 or 16. Anytime that I dressed in a feminine manner or wore makeup in a feminine manner, it felt kind of like a bad costume or a mask that I was wearing. And for a long time, I didn't really understand what it meant. I didn't know who to talk to about it. Our house was kind of conservative, very, we don't judge, but we don't talk about it kind of deal. And it wasn't until I reached community college that I started really learning about, like, the gender spectrum and all that stuff. And one day when I was about 25, 26, I ended up having a sort of breakthrough, where I realized that I was severely unhappy because I did not feel comfortable in the gender that I was presenting in. And I was on the phone with my boyfriend. I broke down in tears. I had this realization of, like, I don't feel right. Like, I want to explore this. And he has been very stable, very emotionally supportive of me. He helped me, like, okay, well, what do you need to do to explore this? He helped me get my first binder, encouraged me to, cut my hair if I felt like I needed that. And I had really long hair at the time, but I always wore it up, like in a really tight bun or really tight ponytail, because seeing it down just made me feel uncomfortable. So I went and I got it cut really short the first time, and I can remember distinctly looking in the mirror and having this wave of euphoria of, oh my God, I look like me. And from then, it's been a journey of I consistently speak with my therapist, consistently exploring my gender. Picking out a name was relatively easy. I was already going by Calico online, and people would usually shorten that to Callie, and then someone shortened it to Cal, and I was like, I like that. And I was working at GameStop at the time, and we would have to answer the phone and, say, thank you for calling. And because people would keep hearing Cal as cow for some reason, I guess maybe my accent, I just started using Calvin. And it felt very natural to continue on from that direction. And, Rose came from when I first started going by Cal. My boyfriend started calling me Cal Rose as, a pet name. And it was very organic from there.
So how many years has it been between, those, obviously it's a journey, like you said, and things when you were younger, but from that breakthrough to where you are now?
It's been about 7-ish years. I have, in the past 3-ish years, I found a doctor, a really good doctor who runs a teaching clinic, specifically helping her graduates, fresh out of medical school, learn how to interact with their LGBT patients respectfully. And she helped me figure out, I wanted to go on gender-affirming care, which included HRT, so I've been on testosterone for almost 2 years now. It'll be 2 years in July.
What does HRT stand for?
Hormone replacement therapy.
Gotcha.
Yeah. And there's, it was a very gradual difference. I have a picture of myself from day one versus now, and you can see day one being almost 2 years ago. You can tell I'm the same person, but you can definitely see the changes that have taken place. I've also, continuing on the journey, I've been looking into options for top surgery, options for other gender-affirming care.
Cal's experience is one that is happening in many households in America. Before we dive further into this topic, let's take a look at some of the history of gender identity debates. Please note that everything that I'm about to cover is going to be listed in the show notes wherever you're watching from. You can see everything and every link that I'm going over now related to all of these topics. Let's start with the gender identity discussion. Dr. Michael Biggs, he is someone who has explored this idea, the history and the concept of transgenderism, specifically as a medical concept, and it's his research that shows that the discovery of cross-sex hormones and advances in plastic surgery contributed to the concept becoming more common, you could say more mainstream. He also outlines how the construct of gender identity or gender role was invented by controversial researcher John Money in the late 1950s and early 1960s. And this is not to say that there weren't any examples of people saying they were transgender or transsexual or different phrases before then, but John Money and really the research of the 50s, 60s, and forward really started to look at gender in a ideological way, and gender identity as more of an ideological position, not simply about being a man or a woman, but more questioning and interrogating the concept on a philosophical and a political level. John Money was born in New Zealand and emigrated to the United States in 1947, where he worked as a psychology resident in Pittsburgh Hospital before being accepted into a PhD program at the Harvard University in the Department of Social Relations. He graduated in 1952 after writing a dissertation focused on hermaphroditism, the condition of having both male and female reproductive organisms. And he was not a medical doctor, surgeon, or psychiatrist. However, his research would go on to influence much of the medical field as it relates to gender. For example, the 2015 book, Critical Essays on John Money's Diagnostic Concepts, really dives deep and outlines the influence of John Money on the transgender conversation. It says, by the mid-1960s, Money's interest had turned to transsexualism and the possibility of surgical treatment. Between 1964 and 1967, he was part of a research team whose study of transsexualism was funded by Erickson Educational Foundation. The latter had been established in 1964 by the wealthy trans man Reed Erickson. Research undertaken by the group was integral to the official establishment of the Johns Hopkins Gender Identity Clinic in July 1966, as well as to the formation of the Harry Benjamin Foundation in 1967. Both of those ended up being very instrumental in advancing these practices. Moreover, Money was, quote, probably more responsible than any other individual for the decision that such an august institution as Johns Hopkins Hospital would endorse sex-altering surgery in suitable subjects, a practice for which at the time there was little support among medical professionals. So you can see how instrumental somebody like John Money was. Further, you go into the history of this, you look at Money when it comes to prescribing testosterone to a 15-year-old girl. That was 1973, and he even considered a mastectomy at that time. So these ideas starting to get suggested on a small scale, nowhere near where we are now, but these are the early seeds of them. Specialist clinics for children and adolescents with gender identity problems were founded in Toronto in 1975, in Utrecht in 1987, and London in 1989. They mainly provided counseling with cross-sex hormones, while cross-sex hormones had to wait until the patient was referred to an adult clinic at an age ranging from 16 to 18, and surgeries were likely not performed. They were performed under, very low circumstances for under 18, and referrals of children were rare. The London clinic, the only specialized clinic for children with gender dysphoria in the UK, over its first decade, accepted an annual average of 14 patients, while the Utrecht clinic averaged 9 per year. So you can see very low amounts. Michael Biggs's paper, which is looking at the history of transgender surgeries as well as gender identity as a ideology, he also looks at the first attempts to lower the age of intervention, which was done by the founder of the Utrecht Children's Clinic, Peggy Cohen-Ketnes. She had first come to prominence in gender medicine in the 1980s and become professor of psychology in the Department of Child and Adolescent Psychiatry at the University Medical Center Utrecht. She believed that transsexuals would have better outcomes if they started treatment before adulthood. And by the mid-1990s, she was referring some patients aged 16 and 17 to the Amsterdam Clinic for endocrinological intervention prior to cross-sex hormones. Males were given an anti-androgen, a cyproterine acetate, which prevented erections and caused breast tissues to grow. Females were given progestin to stop menstruation. Cohen-Ketnes also took these actions based on what she said was evidence from the first 22 patients at her clinic who were interviewed in their 20s from 1 to 5 years after getting surgery. This group was compared to a larger group of transsexuals who had transitioned later in adulthood in previous decades. And this doctor claimed that the 22 patients showed better psychological functioning and, quote, could more easily pass in their desired gender role. However, Big notes that the problem with comparing these two different groups is that one group had transitioned in a more tolerant era, so it's a little more difficult to kind of directly measure their level of happiness. He also said that the patients were still young and most had no sexual partner, and they had not yet reached the age where they might regret not being able to conceive children. Additionally, Big says that the groups has not been followed up long term for additional interviews. And it is through the work of people like John Money, Peggy Cohen-Ketnes, and endocrinologist Harry Benjamin, among others, that young adults and children have begun receiving recommendations for hormones, puberty blockers, and surgery.
A lot of people think it's an instantaneous, overnight decision, and, maybe some people have that wake-up realization, but for most people, it's not an instant thing. It's not like, oh, I just realized I'm a man, time to go, get my chest chopped off and perform all these surgeries. It's a personal journey, and it takes time to fully figure out who you are, just like with any other person. Like, you look at a child at 5 years old, they don't know who they're going to be when they're 40. And it's kind of like, I make jokes a lot that I'm going through my second puberty, because that's basically what the HRT does, is you have to worry about increases in acne, you have to worry about mood changes because your hormone levels are shifting. And people also tend to think that you're going to be causing irreversible damage to yourself. And that's simply not the case, because you if you're going to be on these therapies, you have to be working closely with a doctor. And that doctor, if they're doing what they're supposed to do, is going to be making sure that you aren't causing damage to your body.
Many of the concerns regarding the apparent rise in children pursuing these treatments relates to various data showing that puberty blockers, hormones, and surgeries actually have the potential to cause lifelong health problems. For example, Lupron is one of the most widely used puberty blockers, and it has been associated with several negative side effects. It has the potential to cause permanent changes in biology. And in interviews and online forums, you can find women who have taken the drug as young girls or witnessed their daughters taking the treatment, describing various harsh side effects that have been well documented in adults, including infertility, chronic pain, bone thinning, and other bone problems.
I have heard some of those things, and every medication, regardless of what it's for, has its risks. If you take Advil for pain, you can be damaging your liver. There are regular medications that are like heart medications that can affect your bone density. It's all about what is in the medication. And with the bone density thing, it's usually because when you go through puberty, it's part of while you're growing, and your bones are growing in that as well. And you're stopping certain chemicals from being distributed, and it can affect that. But people who have precocious puberty have to deal with that as well. Like someone who's like 5 or 6 going through puberty, even if they don't feel like they're the other gender or not a gender, they're often prescribed puberty blockers. Like when I was starting HRT, I was given a laundry list of like, these are things that can happen. Like you could start going bald. You could start developing, one of the possible side effects is your body could start producing too much blood, which was a weird one. But they have to let you know of all these things.
Dr. Michael Biggs' article, which was published in the Journal of Sex and Marital Therapy, outlines the history of puberty blockers and hormones and details how little evidence actually exists to back up the claims by some that these processes are reversible and safe. The article, titled "The Dutch Protocol for Juvenile Transsexuals, Origins and Evidence," says the use of these drugs, which are known as GnRHA or gonadotropin-releasing hormone agonist, began in the mid-1990s in the Netherlands. Since that time, this so-called Dutch protocol has quickly caught on and has been adopted by pediatric endocrinologists all over the world. Dr. Biggs' paper discusses how pediatric endocrinologists have ignored concerns about the impact of the drugs on bone density and cognitive function. He also claims that almost all of the young people receiving treatments were actually homosexual and that doctors rushed ahead in prescribing these drugs. And of course, this paper, you can see it linked here. According to his article, Dr. Michael Biggs' article, when the Dutch protocol was first published in an influential article in 2006, it was supported financially by Ferring Pharmaceuticals, which is the manufacturer of triptorelin, another common puberty blocker. So just an interesting aspect of this so-called Dutch protocol that, again, has gone on to become seen as the gold standard. Michael Biggs writes, quote, "It has been a quarter of a century since Dutch clinicians proposed puberty suppression as an intervention for juvenile transsexuals, which became the international standard for treating gender dysphoria. This paper reviews the history of this intervention and scrutinizes the evidence adduced to support it. The intervention was justified by claims that it was reversible and that it was a tool for diagnosis, but these claims are increasingly implausible. The main evidence for the Dutch protocol came from a longitudinal study of 70 adolescents who had been subjected to puberty suppression, followed by cross-sex hormones and surgery. Their outcomes shortly after surgery appeared positive, except for the one patient who died. But these findings rested on a small number of observations and incommensurable measures of gender dysphoria. A replication study conducted in Britain found no improvement, while some effects of puberty suppression have been carefully studied, such as bone density. Others have been ignored, like on sexual functioning." And Mr. Biggs goes on to say that at the Amsterdam clinic, 56 transgender adolescents were treated with GnRHA, commencing at ages ranging 11 to 18 for an average duration of 1.7 years, and after puberty suppression, a significant minority of patients have abnormally low bone density after puberty suppression. He also notes that many people who started on these hormones at a young age have no libido and cannot orgasm. Marcy Bowers, a surgeon who has performed over 2,000 vaginoplasties, has stated that most of the cases cannot experience orgasm. In the conclusion to his paper, Dr. Biggs demands, quote, clinicians need to explain how they are sure that some of the adolescents being prescribed GnRHA would not have grown into gay or lesbian adults with their sexuality and fertility intact. He continues, quote, the claim for irreversibility was contradicted from the outset by the unknown effect of puberty suppression on brain development. Irreversibility has now been demonstrated by randomized control trials in non-human animals. The central justification for puberty suppression was that it increases outward resemblance to the opposite sex and requires less surgical intervention. And he says, quote, paradoxically, however, early puberty suppression for males will most likely make subsequent genital surgery more risky. This is what killed one of the initial Dutch cohort with worst results. And we're going to talk about that in just a moment. What he's saying there is that the puberty suppression for males means guys don't grow a penis and then trying to create like what they call a neo-vagina from that lack of penis. It can be dangerous, as we're going to share in just a moment. Many trans advocates claim that if children and young adults are not given access to these puberty blockers and these hormones, that they may kill themselves. But the data that Biggs and others have found, it actually says the opposite.
Now, it's true that if you ask in a survey, if you ask trans kids, do you think about suicide or have you even attempted suicide? You will get very large numbers, and I think that's obviously that's a real concern. That's a genuine concern. We can't dismiss that. However, that doesn't necessarily mean that the kids are actually at risk of killing themselves, because we know that people tend to exaggerate. In surveys, we know more general, just in the general population, people tend to exaggerate the extent to which they really have attempted suicide. But moreover, there's obviously a concern that when you make suicidality a central part of the identity, that actually that sort of enhances the likelihood of sort of making claims about suicide. Because to be trans in some ways means to be suicidal, because society is rejecting you or your parents are rejecting you. So it's very important to actually know how many deaths result. Not that obviously suicidal ideation or self-harm are obviously important things also, but we do need to have a sensible, a real knowledge about what the actual fatality rate is. And so I use Freedom of Information Act, requests on the Freedom of Information Act to get the data on suicides. And it showed that there were 4 suicides over many years out of 15,000 patients. And of course, that's 4 terrible tragedies. Those are really terrible things. And the suicide rate is higher for trans kids, as far as I can calculate. I mean, estimation is difficult, but it's about perhaps 5 or 6 times higher. So that is, of course, a real concern, and shows that this is a more vulnerable group than the adolescents who aren't trans, don't identify as trans. However, it's also true that the rate of suicide is actually, fortunately, I mean, that's good news, that it's much lower than we might fear. And so I tried to publish this as an academic article, and I was rejected by the British Medical Journal, the Lancet, or Archives of Suicide Research, PLOS ONE. They all sort of rejected the journal article, which of course happens as an academic. But I thought it was interesting that it was very hard to get that information published. It was finally published in Archives of Sexual Behavior, but it's it's interesting how difficult it was to get the good news. What should be really actually good, positive news published. Journals didn't want to. It was sort of unpopular to say that the suicide rate was much lower than we could have feared.
But I do want to acknowledge that according to groups like the American Academy of Pediatrics, the Texas Pediatric Society, the American Psychological Association, and the American Medical Association, they have endorsed so-called gender-affirming care practices and called measures seeking to restrict access as harmful to transgender youth. So that is what those organizations believe.
If you have to be, that kind of argument, if you got to be 21 to drink, etc., that it's not a bad idea for us to set some age limit. What do you think about that? Is that reasonable, or do you think that's unreasonable?
The thing with that is that people forget that there are levels to gender-affirming care. A lot of people are like saying, wait till you're 18 to start even something like puberty blockers, which is like saying, wait until after you've gotten in a car accident to get car insurance.
Because you're going to have puberty before.
Because you're going to have puberty. And if a child knows before they hit puberty, like if they've done the explorations and they've made the realizations of like, yes, I feel like I am a boy, I was born a boy, but I feel like I'm a girl. And then you make them go through a puberty that will make them wake up every day, look in the mirror, and hate themselves. The thing people fail to understand, too, about puberty blockers is, specifically with those, if they realize that they were wrong, all they have to do is stop, and the puberty will start like it's meant to. All it's doing is preventing the certain hormones from entering their body that would change them in a way that they are not comfortable with.
One of the other most controversial aspects of this debate, this discussion, is the, as I said, gender-affirming surgeries, gender-affirming care. These include mastectomies and attempts to create neo-vaginas and neo-penises by using various parts of the patient's body. And while some trans-identified individuals will never pursue these surgeries, an increasing number are. And this argument made by some medical professionals is that by performing these surgeries and affirming a patient's gender identity, they are more likely to live healthier and happier lives. A 2004 review by the University of Birmingham's Aggressive Research Intelligence Facility, or ARIF, found the opposite. ARIF conducts reviews of healthcare treatments for the British National Health Service. The university conducted a review of more than 100 international medical studies of post-operative trans patients. The review was conducted after a request from The Guardian, which said they spoke with several people who had regrets about gender surgeries or believed they were improperly prepared for their new lives. The Aggressive Research Intelligence Facility concluded that none of the studies provided conclusive evidence that gender reassignment is beneficial for patients. It found that most research was poorly designed, which skewed results in favor of physically changing sex. There was no evaluation of whether other treatments, such as long-term counseling, might have helped trans individuals or whether their gender confusion might lessen over time. Chris Hyde, who was the director of the facility at the time, he said there was huge uncertainty over whether changing someone's sex is a good or a bad thing. Hyde even said if surgeries were to be performed only on appropriate patients, there would still likely be a, quote, large number of people who have the surgery but remain traumatized, some to the point of committing suicide. And sometimes the surgeries themselves, they actually do lead to death, as I was saying a few moments ago. For example, this 2016 medical article, again by Dr. Michael Biggs, documents the death of a young adult who used puberty blockers, and it shows that puberty suppression played a role in this young person's death. It was the case of an 18-year-old trans-identified male whose puberty was blocked by Dutch researchers at a very early stage and then underwent surgery in an attempt to create a neo-vagina. However, due to the lack of tissue, surgeons attempted to use a section of the patient's bowel, his colon basically, and it resulted in fatal necrotizing fasciitis. Unfortunately, within 24 hours of surgery, major complications began to arise, and after treating the patient with large doses of intravenous antibiotics and repeatedly surgically removing dead flesh, the patient, who was initially described as healthy, went into multiple organ failure and died. The researchers, they do in this paper, they do their best to kind of convince the reader that performing such surgeries are in the best interest of the patients because it, quote, may improve their standard of living. They write, transgender women with early onset gender dysphoria treated with puberty suppressing hormones report fewer behavioral and emotional problems and an improvement of general functioning. And while this example may seem extreme, the major concern is that these types of procedures are often being done without giving all the data to patients. For example, Swedish investigators involved in the Trans Train documentary acknowledge that despite the nation's medical guidelines recommending top surgery, the procedures are happening despite a lack of long-term scientific data. And this lack of data, as well as the all too common failure of medical professionals to divulge this lack of data, is actually preventing patients from being able to be given true informed consent. A 2022 report from the Williams Institute at UCLA School of Law found that transgender individuals are on average younger when compared to the rest of the U.S. population. This report found that youth ages 13 to 17 are significantly more likely to identify as transgender at 1.4% than adults age 65 and older at 0.3%. And the fact that younger children are identifying as trans at a rate higher than previous generation, this has some people concerned that we might be witnessing social media driving this issue, or at the very least, reinforcing this narrative to confused youth. The rise in numbers of young adults pursuing gender transition treatment has some parents and medical professionals concerned that what we are witnessing is not a natural uptick of individuals identifying as trans because they now feel safe, which is what is often argued by proponents of the trans community, but instead, we may actually be witnessing a form of social contagion. A social contagion is described as behavior, emotions, or conditions spreading spontaneously through a group or a network. The argument is that some individuals who may be confused and/or have genuine gender dysphoria questions, some of which may subside over time, will now find an online subculture which is ready to embrace them and reinforce the idea that their experience is completely normal.
What I usually point out to people who make those observations of like, oh, it feels like everybody's trans nowadays and everybody's, transing their gender and exploring their gender. The rate of left-handedness increased dramatically when we stopped beating people for being left-handed. Does that mean that left-handed people didn't exist before then? No, it means they were hiding, basically. And it's the same thing here. We've reached a point where simply existing as a trans person is not an automatic death sentence everywhere. And because of that, people are feeling more comfortable and more confident being able to explore it and come out and be like, there are people who grew up in the AIDS epidemic and in the 70s and 80s where people were getting, and it sounds like medieval, but people were getting actively dragged out into the street and beaten to death for identifying in a way that others didn't agree with. And because that doesn't happen like it did back then, people feel safer coming out. There are elder trans people who are in their 40s and 50s just now starting to transition because they finally realize that they feel safe doing so.
Some critics point to historical examples of previously unknown conditions being given names and then publicized in journals, only to see an explosion of reported cases of such condition. For example, in 1979, British psychologist Gerald Russell first named the eating disorder bulimia nervosa. By the 1990s, an estimated 30 million people were affected by bulimia. Philosopher Ian Hacking calls this semantic contagion, the idea that naming and describing a condition creates the means by which that condition spreads.
However, to some in the trans community, these questions about the legitimacy of challenging gender identity and gender norms is in themselves a threat to the trans community. In fact, some of the online LGBTQ community can be quite intolerant to those who ask questions about hormones and life-altering surgeries. The online community can be especially hostile towards a group known as detransitioners. Detransitioners are individuals who previously have embraced the transgendered life and perhaps were taking hormones, changing their pronouns, and maybe even doing the surgeries only later to regret their actions. And many of these individuals are dealing with lifelong physical ailments now as a result of the treatments that they previously sought.
There's a small but growing number of vocal detransitioners who are being recognized for attempting to transition or fully transitioning genders only later to come to regret the decision. And some of these individuals have stopped taking hormones after a short time, while others come to change their mind after going through so-called top and or bottom surgeries, which seek to remove breasts on female and alter the genitalia of a male or a female. One of the most well-known detransitioners is a young woman named Chloe Cole, who you may have seen on television or on social media. And at the age of 12, Chloe began taking puberty blockers and testosterone in the hopes of transitioning to be a male. At age 15, Chloe had a double mastectomy to remove her breast. Less than a year later, she came to regret the decision. She has since become a vocal opponent of giving children access to puberty blockers, hormones, and so-called gender reassignment surgery. Now, although it's very difficult to know the amount of detransitioners in different nations and which are being treated in different medical institutions, there are some estimates that say that detransitioners might be 1% of the population, but others, of course, estimate that the numbers are much higher, and they haven't been detected because of a stigma, not only in the general public, but a stigma within the trans community itself. In 2019, investigative journalists in Sweden released TransTrain, the first of several reports examining the nation's policy around gender-affirming care and the potential dangers in recommending such care. These journalists spoke with several detransitioners as part of their investigation, and in this documentary, this young woman, she notes that there is often a backlash for detransitioners who share their stories as they're accused of giving fuel to opponents of medical procedures for children and other trans people. Basically, they get victim blamed and told by you speaking out, you're helping these quote-unquote transphobes.
Det jag fick veta av vården var att det är i princip ingen som ångrar sig. Alltså att någon som jag, som född biologisk tjej, och sen gjort hela transitionen och sen skulle ha gått tillbaka. Det hade jag aldrig hört om.
Ånger, eller detransition som det kallas, är känsligt att prata om i transvärlden. Vi har haft kontakt med Mika i över ett halvår. Hon har hela tiden tvekat om hon vågar berätta.
Jag är rädd för att visa mitt ansikte för att detransition är ett så fruktansvärt känsligt ämne och för att det här är en verklighet som vi inte vill ska vara eller finnas. Jag vill inte visa mitt ansikte för att jag är rädd för vilka konsekvenser det skulle få när det kommer till hur folk ser på att jag berättar min version som aldrig har blivit berättad i Sverige på detta viset tidigare. För att många inom trans- och queer-communityt skulle tolka det som ett hot. Att det finns helt andra historier också. Vi vill så gärna att det ska vara enkelt och inga konstigheter med den här behandlingen och att alla mår bra efteråt. Och den bilden är vi väldigt bra på att visa utåt för att få mer acceptans och förståelse och sådär. Och det ser jag också en poäng med. Men vi måste kunna visa alla historier som finns. Och absolut inte för att skada någon, men för att ge den bästa behandlingen möjligt och för att ställa rätt diagnoser på folk.
And now I want to give you the example of the man James Caspian, who's a psychotherapist who specializes in working with transgender people, and he has faced backlash for proposing research about detransitioning to the Bath Spa University in southwest England. He was enrolled in a Master of Arts program at the university and sought to document what he says are a rise in number of detransitioners. And after they initially accepted his proposal for his research, they changed their minds and they rejected it. He continued to defend his work, and he's even taken his case to court, and I believe he's lost, but he's continued to fight it, trying to take it to the European Court of Human Rights. And he eventually published his paper and his research independently. But it's just one example of how trying to even just talk about this topic can be seen as dangerous, or it definitely won't get you friends. And while detransitioners are a part of the conversation, an August 2023 study, a survey of 139 people, said that 2 or more years after their mastectomies, they had low rates of decisional regret and high levels of satisfaction with decision following gender-affirming mastectomy. However, the researchers called for further research and condition-specific instruments to access decisional regret and satisfaction with decisions. So basically, they seem like they said they think there should be more research, like their tools weren't adequate. You need condition-specific instruments to assess regret accurately and satisfaction following surgery. So I just want to put that in there, that there are new studies coming out and studies coming out claiming that everything's fine, that nobody has any issues with this, but there's others who are trying to draw attention and show that detransitioners in fact do exist.
Another major area of concern relates to studies highlighting the overlap between those on the autism spectrum and those identifying as transgender.
For example, a February 2022 independent review commissioned by the NHS in England and the NHS Improvement highlighted a number of issues relating to gender identity and gender dysphoria treatments. The review, led by Dr. Hilary Cass, what became known as the Cass Review, and Dr. Cass is a former president of the Royal College of Pediatricians and Child Health, it found that, quote, approximately 1/3 of children and young people referred to the UK's Gender Identity Development Service, or GIDS, have autism or other types of neurodiversity. Now, it goes on to say that another study in 2020, August 2020, found that individuals who do not identify with the sex they were assigned at birth are 3 to 6 times as likely to be autistic as those who identify with their biological sex. It also found that so-called gender diverse individuals are also more likely to report autism traits and to suspect that they have undiagnosed autism. The results come from an analysis of 5 unrelated databases that all include information about autism, mental health, and gender. And these data sets included more than 640,000 people, 30,000 people with autism, and 3,700 plus people identifying as gender diverse. They explored the relationship between gender identity and 6 other mental health conditions which can occur simultaneously with autism, including schizophrenia, depression, and ADHD. The study found that so-called gender diverse people have higher rates of all 6 conditions than cisgender individuals. The highest reported association was autism and depression. And the authors conclude, quote, our study demonstrates that transgender and gender diverse individuals have elevated rates of autism diagnosis, related neurodevelopmental and psychiatric conditions, and autistic traits compared to cisgender, parentheses, normal individuals, those are their words, not mine. This study has clinical implications by highlighting that we need to improve access and care, tailored support for this underserved population.
Did you already have any kind of mental health issues, or were there things that you were dealing with prior to this that maybe were surfacing in other ways before you came to these conclusions?
So before I had my big breakthrough, my realization, I had already been diagnosed generalized depression and anxiety. I hadn't been officially diagnosed autism or ADHD. Those came recently. But I definitely do think, and I remember after having the realization, speaking to my therapist and my psychiatrist, and my therapist saying, like, this could be the cause of your depression, is feeling like you're being forced to be a person that you're not. But there are also, like, multiple causes. It's not just, here's the one thing that's making you depressed. Boom, it's fixed. No more depression. And I deal with childhood trauma, and I was dealing with my gender identity. And since coming out and since realizing the person that I am, I definitely feel much less depressed, but that doesn't mean that it just magically went away. It wasn't the sole cause, but it was definitely a piece of it. And I do think mental health needs to be, what's the word I'm looking for? It needs to be more accessible for people, especially because people want to immediately say, like, oh, they're mentally ill. Okay, so let's put money into therapy. If you think it's a mental thing, why are we not to help? Because they always want to say, like, oh, it's a mental health crisis. It's a mental health crisis. But they're constantly taking funding away from mental health. So
for you, I mean, you're from your perspective, it is true that for some people it could be a mental health issue. For others, perhaps this is really what they're feeling. They don't feel like they're in the right body, etc. Feelings like that.
Well, more like, not that the mental health, like a mental illness or whatever, is causing it.
Sure.
More like it's
part of a kind of.
It's part of a bigger thing. Like, is me being trans being caused by mental illness? No, I'm a trans person. That's who I am. I am a trans person who also has depression and PTSD and ADHD and a bunch of everything, because mental illnesses are buy one, get 50 for free.
What do you think about, I've been digging into seeing some of the different data out there about, and I think it's just correlations at the moment. Nobody really knows what it means, but there definitely seems to be some overlap between, I can't remember the percentage, but individuals who are on the autism spectrum and find their way to exploring gender identity, and individuals who dealt with depression, etc. You know, again, like you said, you don't feel like that's what's causing it, but there's a relationship.
I have noticed there is a Venn diagram of people who are trans and people who are on the autism spectrum, and there's
So with all of this information regarding the lack of long-term safety data for hormones and body-altering surgeries and detransitioners speaking out to warn others and signs of a potential social contagion, why does it seem like these aspects of the conversation are not being highlighted by the media, academia, or the medical establishment? Instead, we see the media, academics, and various medical professions promoting transgender rights despite the potential for harmful outcomes.
Before we look at the network behind this and the various individuals who are profiting and promoting transgender surgeries and care, but also the ideology behind it, let's look at some of the shifting government policies. And if you see this sign right here, the Tavistock Center, Tavistock and Portman, and as NHS Foundation Trust, this is definitely one of the organizations that has been involved in this, and we're going to talk about how they have failed horribly. Michael Biggs, I've used his research quite a bit in this series here, but he's not the only person to publish papers discussing the flaws in the Dutch protocol. In January 2023, researchers published the paper The Myth of Reliable Research in Pediatric Gender Medicine, a critical evaluation of the Dutch studies and research that has followed, also in the Journal of Sex and Marital Therapy. They conclude, quote, "The question, just because we can, should we, is not unique to pediatric gender medicine. What makes this arena exceptional is the radical, irreversible nature of gender-affirming medical and surgical interventions desired by the exponentially growing numbers of youth in the Western world." They continue, "Another unique aspect of the gender medicine field is that a number of clinicians tasked with caring for the gender distressed have taken on the role of political campaigners, and in doing so have traded wisdom and nuance for blunt activism. Their insistence that today's gender dysphoric teens are tomorrow's transgender adults, and that their future happiness and mere survival hinges on early access to gender reassignment, is demonstrably false. While still reported as rare by the gender medicine establishment, the rate of medical detransition is already 10 to 30% just a few years following transition. These numbers are likely to rise in the future, as regret historically has taken over a decade to materialize." So those are some pretty strong words from these researchers. Again, that is linked there in the show notes. You can find it. But is this questioning of the Dutch protocol, which is now leading several European nations in the last couple of years to reverse their gender-affirming interventions for youth? And again, this is one of the reasons why I'm talking about this topic, because I don't think Americans are getting the full picture of what's going on, and we need to look to some other areas where they've been trying some of these tactics and gender-affirming care and practices, and now they're sort of getting the data to see what works and maybe what doesn't work. Finland was one of the first countries to adopt the Dutch protocol, but it was in 2020 that Finland announced that they were diverging from the recommendations of the organization known as World Professional Association for Transgender Health, which is an extremely important piece of this puzzle that we'll have to look into another time. But in terms of recommending transgender policies, much of it comes down from the World Professional Association for Transgender Health. And they released their own new treatment guidelines, which, and I'm saying they being Finland, they released their own new treatment guidelines advising against the use of puberty blockers and other medical interventions in favor of psychotherapy as the first-line treatment for gender dysphoric youth. So this is them saying, we're going to not follow what the World Professional Association for Transgender Health says, and we're going to say, let's use psychotherapy first as the first-line treatment and back off puberty blockers and other medical interventions. Finland did not ban pediatric medical transition, that's transition for kids, but their guidelines now urge caution given the unclear nature of the benefits of these interventions. And instead, Finland reserves puberty blockers and cross-sex hormones for minors with early childhood onset of gender dysphoria and no co-occurring mental health conditions. So they basically have to show like this person does not have any of those other traits we talked about a moment ago, schizophrenia, depression, ADHD, etc., and they're really suffering from early childhood onset of gender dysphoria before you start giving them puberty blockers or any of that. So hopefully those changes do lead to more children being protected. And I say that not just in terms of them not being given treatment, because if they were to find that that is truly what's best for them in some rare cases, then let that be the situation. But if that's not the case, let's make sure kids aren't being rushed into that. And one of the best vocal sources on this that you can find plenty of interviews out there, and I have linked to a few of them here. Her name is Dr. Rita Kertu Kaltiala. She's Finland's top top expert on pediatric gender medicine in Finland, and the chief psychiatrist at one of its two government-approved pediatric gender clinics. She's also spoken out about the rush to gender intervention. She's been appearing in different interviews. She also was invited to speak in Florida in the United States during the COVID panic and really share from her experience of what they're doing in Finland and why they're changing their policies. And so she's another person who's become outspoken just as a doctor. And in Sweden, we have seen similar actions taken. There's the Trans Train documentary, which you've now seen clips of here, and I've referenced throughout this report, and I will include the links too because I think it's really great work. That Trans Train documentary focused on the outcome of Sweden's gender interventions, which have become increasingly common. And due to Sweden's embrace of gender interventions, there is a lot of data on the long-term outcomes in their country. For example, a 2011 study, which has been hailed as one of the most thorough follow-up of sex reassigned people, documented the struggles of Swedish trans individuals decades after surgery. The study concluded that 10 to 15 years after surgical reassignment, the suicide rate of those who had undergone sex reassignment surgery rose to 20 times that of comparable peers. So that's a pretty high rate, a pretty big jump. In May 2021, the Karolinska Hospital in Sweden issued a policy statement regarding treatment of gender dysphoric minors. The hospital said they would be ending the practice of prescribing puberty blockers and cross-sex hormones to individuals under the age of 18 at their Astrid Lindgren Children's Hospital. And such treatments would only be given under exceptional circumstances or in a research context. By February 2022, Sweden's National Board of Health and Welfare announced they would follow the Karolinska's lead and issued a national policy update closely mirroring the policy adopted by the hospital. So basically adopting a similar situation, saying they're not going to be prescribing puberty blockers and cross-sex hormones for those under 18 except under exceptional circumstances or in research context. Then we've seen changes in France, where the National Academy of Medicine recommended the greatest reserve in the use of puberty blockers, and in Norway, a national investigation board expressed concerns about the treatment. So more people speaking out in different ways. And then the UK, I think, is one of the biggest examples we have of a sort of change in policies. The UK has really making big shifts away from recommending gender interventions for minors. In October 2022, England's National Health Service announced a move away from the, quote, gender affirmative care model towards what they call a more holistic care approach. In June 2023, England's National Health Service announced new limits on the use of puberty blockers for minors, except as part of clinical research. And this policy, they have an interim policy, says that puberty-suppressing hormones, GnRH analogs, are not routinely commissioned as there is, quote, not enough evidence to support their safety or clinical effectiveness as a routinely available treatment, and that they should only be accessed as part of research. The review said that many children referred to the UK's Gender Identity Development Service, GIDS, health clinic have complex needs that may have been overlooked, and it noted that about 1 in 3 children have neurodiverse mentalities, which is what we've shared in the other part of this investigation here. And so these changes, these shifts, those are just in 2022, 2021, 2023. But these actually come after years of issues within the GIDS clinic. And again, the GIDS is Gender Identity Development Services, which is run by the Tavistock Center, or the Tavistock and Portman NHS Foundation Trust, sometimes just called Tavistock. In early 2019, Marcus Evans, who's one of the governors of the board of the Tavistock, resigned after accusing management of having a, quote, overvalued belief in the GIDS clinic, which he said is, quote, used to dismiss challenge and examination. And in 2020, Sue Evans, who is also part of the Tavistock, she crowdfunded to get a judicial review of Tavistock's practices. She had been attempting to raise alarm bells in Tavistock since the early 2000s. And both Susan and Marcus Evans have since become whistleblowers discussing what they witnessed while working for Tavistock. They're both, you can find them on podcasts all over the internet. Sue, again, was involved in this groundbreaking lawsuit with Tavistock. She sued the trust along with Kira Bell, who was an individual who began transitioning to male before later detransitioning. And the lawsuit said that the Tavistock provided, quote, potentially misleading information about hormones and that proper consent was not given. And the Guardians also reported that some parents have accused the service of fast-tracking young people into changing gender, and of course they deny that aspect. So there's just all kinds of craziness going around there, and again, this September 2020 independent review led by Dr. Hilary Cass called for a fundamentally different model of care for children with gender dysphoria. And as I mentioned before, Cass is a pediatrician, former president of the Royal College of Pediatrics and Child Health. The interim report was published in March 2022, and it said that the rise in referrals had led to the staff being overwhelmed and recommended the creation of a network of regional hubs to provide care and support to young people. The report noted that the clinical approach used by GIDS, quote, has not been subject to some of the usual control measures typically applied with new treatments, and raised concerns about the lack of data collection by GIDS. So just all kinds of problems came out through this Cass review, and the Tavistock Clinic is slated to close by March 2024. It was supposed to be closed already, but it's been delayed. We'll see if it actually happens. And that's all just been the UK. I mean, so we've just gone over Finland, Norway, obviously the UK, Sweden, and so it's happening in different countries, rethinking obviously Denmark, the Netherlands, other places. So let's look at what's happening in the United States, where the climate here in the U.S. is a little bit more hostile and I think divided. Maybe it's similar to other places, but it's become sort of the norm with new states trying to pass bills which would limit gender transition surgeries, puberty blockers, and hormones. The U.S. government has already made a couple statements regarding safety of these things, actually, and this is what the interesting part. Again, I think that the information's out there, but I don't think the people who are debating about this on the internet are getting this information. In July 2022, a warning was added to puberty blockers after identifying a serious potential side effect for some that may cause a dangerous surge of spinal fluid pressure in the brain that can cause headaches, nausea, double vision, and even permanent vision loss. 2016, during the Obama administration, the Centers for Medicare and Medicaid Services, they considered whether gender reassignment surgery would have to be covered by Medicare plans. And despite receiving requests that it would be covered coverage be mandated, it refused to do so and cited a lack of evidence that it would benefit patients. And this is the official response from the Obama administration. Based on a thorough review of the clinical evidence available at this time, there is not enough evidence to determine whether gender reassignment surgery improves health outcomes for Medicare beneficiaries with gender dysphoria. There were conflicting, inconsistent study results of the best designed studies. Some reported benefits while others reported harms. The quality and strength of the evidence were low due to the mostly observational study designs with no comparison groups. Many studies that reported positive outcomes were exploratory type studies, case series, and case control with no confirmatory follow-up. The final August 2016 memo is even more strongly worded, and again, this is from the Medicare Center in the U.S. government. Overall, the quality and strength of evidence were low due to mostly observational study designs with no comparison groups, subjective endpoints, potentially confounding small sample sizes, lack of validated assessment tools, and considerable loss to follow-up. So basically they're saying these studies were not done really good in any way to prove that it would be in the best interest of people's lives to change these things. So that's kind of where some of the statements that the U.S. government themselves have made.
The final point I'd like to make is that there are those who believe we are witnessing a push to divide the public over this issue and to shape a narrative that says transgender people and gender identity issues are much more prevalent than they actually are.
An exhaustive list of those who are promoting and benefiting financially from the various industries which are involved in transgender health services includes everyone from endocrinologists and surgeons, pharmaceutical companies producing hormones and puberty blockers, various nonprofits and foundations. We have named a few of these players, and we are going to outline them in this last section. Oddly enough, some of the highly educated doctors appear to have convinced themselves that they are doing is genuinely for the health of the patients. In the Swedish documentary Trans Train, Dr. Ola Soder is interviewed about his work as an endocrinologist at the Karolinska University Hospital, and when discussing why he prescribes patients hormones and other treatments while knowing that there are potential consequences, he said, quote, "You must weigh the suffering the patients would go through without that treatment." He also acknowledges he was giving out hormones without follow-up on the long-term effects before lamenting, quote, "Well, these people are suffering and they're asking for help." We also have the case of Dr. Deanna Adkins, a professor at Duke University School of Medicine and the director of the Duke Center for Child and Adolescent Gender Care. Dr. Adkins provided an expert testimony to a federal district court in North Carolina concerning a state law governing access to sex-specific restrooms. In her testimony, Dr. Adkins contradicted accepted biology and revealed an ideological bent by stating, quote, "From a medical perspective, the appropriate determinant of sex is gender identity." Dr. Adkins argues that gender identity is the preferred basis for determining sex in an individual and, quote, "the only medically supported determinant of sex." Adkins also claimed it was counter to medical science to use chromosomes, hormones, internal reproductive organs, and external genitalia to override someone's chosen gender identity. When examining the various players involved in the promotion of transgender treatments, we ought to distinguish between those who are benefiting financially from providing various health interventions to adults and children, and those who are benefiting from the promotion of transgender ideology itself. I believe these groups are separate, but also occasionally their paths overlap. Both are involved in normalizing these dangerous practices, but their motivations and their goals appear different. For example, a doctor diagnosing a young adult with gender dysphoria may well be genuinely stating their medical opinion without a bias or an ideological motivation. At the same time, you also have teachers, parents, or family friends who may be motivated by an ideology that says gender is fluid, or a term that is more recently being used, gender expansive. This distinction matters because the idea that every individual involved in the gender dysphoria to transgender pipeline is ideologically motivated is not currently supported by the evidence. As noted with Dr. Deanna Adkins, there are examples of individuals within the medical industry and nonprofits focused on LGBTQ healthcare who do have ideological reasons for promoting gender transition services, but this does not account for everyone who is a part of the broader conversation. Some of these individuals may be well-meaning, compassionate people who support the general message of equality, inclusion, and fairness for all people without understanding the health concerns and dangers that we have uncovered in this series. In the United States, the transgender ideology is most visible within Hollywood celebrities, pop culture musicians, social media influencers, and legacy mainstream media. Again, some of these people might be more passive supporters than die-hard ideologues who want to destroy the concept of gender for various political reasons. Others, especially corporations, are likely following trends because they know what is profitable and they want to appear compassionate. The top executives within these corporations may also be ideologically motivated as well. We also have pop culture magazines like Scientific American getting involved in blurring the lines between gender and sex. The magazine published an opinion piece written by Agustin Fuentes, professor of anthropology at Princeton University, titled, "Here's Why Human Sex is Not Binary. Ova don't make a woman, and sperm don't make a man." This piece is just one of hundreds of reports, blogs, and political essays disguising themselves as news which can be found across the media landscape. To be clear, I believe we should question and interrogate ideas surrounding gender roles. I do not subscribe to the idea that all women should be stay-at-home moms, raising the children while their husband provides financially. I also don't subscribe to the idea that there is anything inherently wrong with such an arrangement. We shouldn't be stuck in the idea that all boys should wear blue and all girls pink, but we also shouldn't punish anyone who wants to subscribe to, quote, traditional gender roles. The point is that while there are legitimate questions and conversations to have regarding gender and sex, the discussion has been hijacked by a well-financed, decentralized network of ideologues who want to destroy the concept of gender altogether. Environmental activist and researcher Jennifer Billick has done some of the most extensive research looking at the corporate forces behind transgender ideology. She says she began researching the groups behind this movement after she was deplatformed in 2013. For this final section, we're going to be looking at two of her articles, which I believe are some of the most extensive work done examining the network behind transgender ideology. She writes, "I have watched as all women's safe spaces, universities, and sports open their doors to any man who chose to identify as a woman. Whereas men who identify as trans women are at the forefront of this project, women who identify as trans men seem silent and invisible. I was astonished that such a huge cultural change as the opening of sex-protected spaces was happening at such a meteoric pace and without consideration for women and girls' safety, deliberation, or public debate." Jennifer Billick goes on to describe the identities of the billionaires who she sees as major players who are funding the transgender lobby and funding various organizations via their own philanthropic outfits and corporations. This includes Jennifer Pritzker, who is a male who identifies as transgender, George Soros, the infamous billionaire, Martine Rothblatt, a male who identifies as transgender and transhumanist, Tim Gill, a gay man, Drummond Pike, Warren and Peter Buffett, John Stryker, another gay man, Mark Bonham, a gay man, and Rick Wyland, a recently deceased gay man whose philanthropy is LGBTQ focused. And as Jennifer Billick highlights some of these donors, they use anonymous funding, different anonymous funding sources to be able to get their message out. And specifically, they're using organizations like the Tides Foundation, which is founded and operated by the aforementioned Drummond Pike. And this allows corporations, philanthropists, and organizations to send huge amounts of money to Tides with instructions on where it would go. And all of this is done anonymously using the Tides Foundation's legal firewall and tax shelter for foundations while funding political campaigns. So it allows, as usual, these philanthropists to give their money and use different tricks to hide where the money's going and for what purposes. But we can track the money to some degree, as Jennifer Billick has done here, and she can see that there are clinics for LGBT children coming about from this funding. There are hospitals with new centers and think tanks using this money for the advancement of this ideology and the alleged treatment. This influx of funds led to the first gender clinic for children opening in Boston in 2007, and in the decades since that clinic opened, there are now more than 30 clinics for children who allege to have gender dysphoria, which are now operating in the U.S. alone. And she goes into some more of the funding, and I think this is really kind of disturbing / just mind-boggling to see how so few individuals with money and connections are really behind the pushing and advancing of these ideologies and these belief systems in the universities. As noted before, there is a difference between those who are simply funding the advance of transgender care and those who are funding these efforts because of a support of transgender ideology. As Jennifer Billick writes, quote, "They are shaping the narrative about transgenderism and normalizing it within the culture using their funds. This can hardly be a coincidence when the very thing absolutely essential to those transitioning are pharmaceuticals and technology." So again, they're funding the various technologies, they're funding the push for going beyond transgender to transhumanism, and there's a lot of money and potential within here and potential for profit. As she notes here, transgenderism sits square in the middle of the medical industrial complex, which is by some estimates even bigger than the military industrial complex, and I would agree with that. And now she gets into the Pritzker family. As I've mentioned, there are families or individuals behind the funding of this, and the Pritzker family is an American family of philanthropic billionaires who are worth an estimated $29 billion. And their fortune comes from nursing homes, the Hyatt hotels, and various investments in the medical industrial complex. So we can start to look at their family with Jennifer Pritzker, who was once a man who was in the military and has now been rebranded as Jennifer Pritzker, a transgender individual. They have made transgenderism a big part of their philanthropic funding through the Taiwanese Foundation. And Jennifer Billick describes Jennifer Pritzker as, quote, "one of the largest contributors to transgender causes who has had, quote, enormous influence in the rapid institutionalization of transgenderism." Some of the organizations owned by Jennifer Pritzker include Squadron Capital, which is an acquisitions corporation with a focus on medical technology, medical devices, and orthopedic implants. The Taiwanese Foundation we've just mentioned, a philanthropic organization with grants focus on gender and human sexuality. Pritzker also sits on the leadership council of the program of human sexuality at the University of Minnesota, which they have given $6.5 million in the last decade plus. Pritzker also funds the Lurie Children's Hospital in Chicago, a medical center for gender nonconforming children. The Pritzker School of Medicine at the University of Chicago as well. They also fund a chair of transgender studies at the University of Victoria, the Mark S. Bonham Center for Sexual Diversity Studies at the University of Toronto. So again, not only funding the sort of medical side, but definitely funding the ideological side, the educational side of getting people to believe in these sort of ideologies. And the Pritzker family are also involved in funding the American Civil Liberties Union and Planned Parenthood, two of the organizations which are most responsible for supporting transgender causes. And as I pulled some research from our friend over at Corey's Digs, Corey, who's an amazing writer, she wrote in her 4-part series, in part 3 of that series, about Planned Parenthood, quote, "One of the biggest organizations the government funds is Planned Parenthood. Coincidentally, Planned Parenthood is now the second largest provider of gender-affirming hormone therapy. From 2016 to 2017, they received more than $540 million in funds from all levels of government. And between 2013 and 2015, that was $1.5 billion in federal funds. $1.2 billion was from Medicaid, and another almost $300 million came from 6 different departments within the government. So funding universities, funding hospitals, funding colleges, funding groups, private organizations, and nonprofits that are advancing these same causes. And Jennifer Bilek goes through and does just a real good highlight of all the different money going from Jennifer Pritzker to different places. But Jennifer Pritzker is not alone. You also have Penny Pritzker, part of this family. But the interesting thing to note, again, when you want to understand how the money flows, Jennifer Bilek notes that Jennifer Pritzker gives to universities which are beholden to transgender ideology and whose students, quote, "go on to spread gender ideology by writing pro-trans articles and medical journals and elsewhere." Jennifer's uncle and aunt, John and Lisa Pritzker, they've also given $25 million to the University of California at San Francisco for a center of children's psychiatry. And what do you think that psychiatric center is going to do but probably promote gender dysphoria? The Pritzker's family includes Penny Pritzker, cousin of Jennifer, and Illinois Governor J.B. Pritzker, who is the brother of Penny. So you've got Jennifer, you got Penny, you got Illinois Governor J.B. Pritzker. Chicago seems to be a big focal point for them. And both of these are major sources of funding for the transgender movement. Jennifer Bilek also points to Jeanne Pritzker, who is married to JB's brother Anthony. So you got Jennifer Pritzker, Penny Pritzker, Illinois Governor JB Pritzker. JB's brother is Anthony, who is married to Jeanne. And Jeanne is a training psychologist at UCLA, where she and her husband established the Anthony and Jeanne Pritzker Family Scholarship to support medical students at UCLA. Again, what do you think they're trying to do here but to bring in more people into this fold through their funding? We can talk about George Soros and Gil, who are both mentioned, 2 of the other major transgender movement funders who have generated millions of dollars to help get Obama elected, and Stryker, who is one of the top 5 contributors to Obama's campaign. Under both Obama and George W. Bush, the federal government funded the Tides Foundation to $82.7 million, which donated $47.2 million to LGBTQ issues over the last 2 decades. So you see how it comes from taxpayers to the government to these institutions. You are funding for these programs, whether you like it or not. And in the role as governor since 2019, J.B. Pritzker, who again is the brother of Penny Pritzker, the cousin of Jennifer Pritzker, an American venture capitalist, entrepreneur, philanthropist, business owner, co-founder of the Pritzker Group, which is a private investment firm that invests in digital technology and medical companies. And they have an international presence all around the world. And JB ran for governor of Illinois in 2018 and won, and has now been in that position, continuing to fund these types of projects. He sits on the board, for example, of directors at his alma mater, Duke University, where they're making advances in cryopreserving women's ovaries. Why would they want to do that? And as governor, which is covered in this one here, you can see in Jennifer Bilek's second article, The Billionaire Family Pushing Synthetic Sex Identities, right here. On the left, philanthropist Jennifer Pritzker, formerly a man, clearly still a man. And Illinois Governor J.B. Pritzker right here. This family, for whatever reason, is pushing these ideas. And the man on the right is the current governor of Illinois, where he, on June 30th, 2019, issued Executive Order 1911, which was titled Strengthening Our Commitment to Affirming and Inclusive Schools to Welcome and Support Gender Dysphoric Children. A task force was launched to pressure school districts to amend their school board policies to, quote, strengthen protections for transgender, non-binary, and gender non-conformity students. Governor Pritzker signed a sex education bill as well for Illinois in August 2021. So lots of their energy and time is going towards this area. In addition to funding for pharmaceutical companies such as Janssen Therapeutics, the Health Foundation of Johnson & Johnson, ViiV Pfizer, Abbott Laboratories, Bristol Myers, Squibb Company, and Boehringer Ingelheim Pharmaceuticals. Big tech firms are also funding the transgender movement, including Google, Microsoft, Amazon, Intel, Dell, and IBM. One final note is that Jennifer Billick's research here in both these articles, it mentions the name of Martine Rothblatt. Martine Rothblatt is an individual who is the author of a book called From Transgender to Transhumanism, a Manifesto on the Freedom of Form, a male who identifies as transgender and transhumanist. In upcoming future installments of this series, video and written series, we will be fully fleshing out the overlap between those with transgender ideological beliefs and those who support transhumanism, the idea that humans can evolve beyond gender and other apparent human limitations altogether by merging with digital technology. We will be exploring that soon.
As I wrap this report, I want to remind viewers my goal is not to offend, divide, or fuel hatred. I've made efforts to conduct this research and share my findings because I believe this is one of the most important conversations that needs to be had with young people who are going to be exposed to issues around the transgender topic and gender identity issues via the corporate media, public schooling, and of course, social media. If we can't have an honest discussion about the potential pitfalls of hormones and surgeries, we will not get to a place of real understanding. I encourage everyone who has concerns on any sides of this discussion to practice empathy and compassion, and to remember that there are human beings involved in this complex situation. Only from that place can we build towards truth. Thank you all for listening. This is Derrick Broze with the Conscious Resistance Network. Remember, you are powerful, you are beautiful, and you are free.
The person that you are and that you're going to become is who you were meant to be. And if you're lucky, you will have a support group and you will have family that make you feel safe in exploring that and coming to that and becoming that person you were always meant to be. And the only thing I can hope for my trans siblings or for the trans people who haven't realized yet or haven't been born yet is I hope this